Dr. Farley. Today I'm going to be going over with you neurodegenerative disease and specifically talking about dementia and Alzheimer's. Depending upon where you look, there's either 5 or 7 stages of the disease. And what we really know about this is that the medications are not doing much for a lot of people. If you read the research on them and you go online and you look at these, it says it may get a very small improvement for a very short time frame. Then we add in a second medication, sometimes a third medication. But the bottom line is that there's a pretty rapid decline in the neurodegenerative disease and the dementia process. And then they move through different stages. What I want to go over with you is that there's really 3 different approaches to this problem. The first approach is the traditional allopathic drug model, which is what we just talked about. You wait until there's enough damage within the brain to then diagnose someone with minimal degenerative damage, minimal cognitive impairment, or then moderate, then severe or extremely severe. And then depending upon where they think you are, they give you the appropriate med. But the bottom line is the med, again, does not have a great outcome. Within 1 year, usually there's rapid decline. And there's also research that sometimes the medication itself might be part of that rapid decline. So for most people, there's not much help that they can get. The second approach may be someone that tells you, hey, I heard this vitamin or mineral or herb might be good for memory. And you might go to an integrative medical doctor, a holistic practitioner, a chiropractor, a nutritionist, and they give you different nutrients or vitamins and minerals and herbs that have been shown to help with memory. The problem with that is there's not a lot of research on that, and we really don't know what's going on with that specific person. How I approach the problem, my Farley neurobiomedicine approach, looks at each individual person individually, and we come up with a personalized plan based on what we find is wrong inside that person. So we could have 10 people with the same dementia, mild, moderate, or severe cognitive decline, and they may all need to be treated differently depending upon what's wrong inside that person's body. What I want to go over now is just some basic function of the brain, because we need to understand how the brain works if we're ever going to make the brain work better and potentially stop this process or even reverse some of this process. Inside the literature in functional neurology, which is how I approach this problem, we do functional neurology and then also functional neurobiomedicine. We combine those together, and basically what we can do is we can give the brain what it needs to work properly. So there's 3 things that the brain needs to work properly. Number 1 is activation. Number 2 is oxygen. And number 3 is nutrients. And under nutrients, we want to have stable blood sugar. So those are the 3 things that the neurons or the brain needs to work properly. So if we're talking about restoring someone's brain health, to me, if we approach this from a physiological point of view and look at the 3 things the brain needs, we might find some areas that are not working properly, and we might find some clues as to why that person's brain is going through what we call transneuronal degeneration and breaking down, and then you're going to get your dementia symptoms, and over time it's going to get worse and worse. So let's talk about the first thing, activation. Activation comes from your peripheral receptors in your body. You have 7 sensory inputs: skin, muscles, joints, eyes, ears, taste, and smell. In your skin, muscles, and joints, what we know is that 90% of the total brain activation comes from the skin, the muscles, and the joints. So that means that we can do different things with the skin, the muscles, and the joints to activate that brain and give the brain the essential physical activation, the stimulus it needs to turn on and work. Activation is first, then nutrients and oxygen comes behind it. Without proper activation, nutrients do no good. With proper activation and nutrients, you're going to get a synergistic effect. The next step down is oxygen. I find numerous patients come in with low levels of anemia, 1 to 3 different types that are not being addressed. If the brain doesn't have proper oxygen, the brain will not work properly and the neurons will die. We know this for certain. We also find that a lot of people with anemia have undiagnosed gastrointestinal problems, which is creating some of the anemia. and also potentially their autoimmune problems, creating some of the anemia and possibly even autoimmune reactions against the brain itself. The third component is nutrients and stable blood sugar. Under stable blood sugar, we don't want to have blood sugar that's bouncing around, and many people that I consult with that have dementia and neurodegenerative diseases are having blood sugar that's bouncing all over the place. The baseline number of, let's just say 90, 92 is not being maintained at all. So the person's either going too high or too low. If you're a diabetic and you have any signs of dementia, we have to look at that because that's definitely a key component. They're now saying that type 3 diabetes is now the same thing as Alzheimer's, which means that, again, the blood sugar is a key component to this. And then lastly, we see over here is nutrients under the same number 3 here. Under nutrients, we have to give the brain what it needs, and we have to remove any toxicity that the brain may be getting. So how I approach this problem is we look for areas that are not, is the brain getting proper activation? Usually it's not. Does the brain have proper oxygen and there's no anemia? Usually there's a major issue there. And lastly, do we have proper nutrients and stable blood sugar? Another thing that you want to know is many people that are having issues with the brain is also happening from undiagnosed gastrointestinal problems. So if you have neurodegeneration, dementia, Alzheimer's, Parkinson's, any other type of neurodegeneration, and you have gastrointestinal problems, they are connected. Because the gastrointestinal system houses 80% of the immune system, and that's a key player in keeping our brain working well or not. The other thing is that most patients also may be having autoimmune reactions going on directly against brain tissue themselves. So if you have a diagnosis of a thyroid issue, if you're a diabetic, if you have lupus, scleroderma, any of these other autoimmune reactions, you may also be having autoimmune reactions directly against the brain tissue itself. If those underlying root functional causes are not addressed, your healability and the brain to work properly will never happen. And you will see a continued decline with you or a loved one. If we can figure out one of these 3 areas, or all 3 many times, that are not working properly or not being supplied, and we find that there's a problem there, we can actually address specifically where the problem is, give the brain what it needs to stop this terrible degeneration, and to possibly reverse some of it. Now, how do we know whether it can be reversed or not? A good, thorough, functional neurological evaluation can measure and find deficits. We can baseline the person and say, this is where brain function is now. You can apply treatment, and then you can go back and re-examine the patient, and there should be an improvement. At the same time, you add in the biomedicine part of it, which allows us to know exactly what's going on from that point of view. How's the biochemistry working? And we marry the 2 of them together, called neurobiomedicine. So that's the Farley method, neurobiomedicine, and how we approach dementia and neurodegenerative diseases. We can't help everyone. If the problem is very severe, and you've let it get to a point where there's significant damage to the neural axis, I may not be able to help, and you would not qualify for care. If the problem is somewhat recent, even moderate to severe, there's a good opportunity for you to potentially get better. And we would do an evaluation to see whether or not your case would qualify or not. If your case doesn't qualify, I would let you know why. If your case does qualify, I would try to give you some options. So I hope this was informative. I hope that you got some information about how the brain works and what the brain needs to work properly. When you're looking at a lot of the medications are all aimed at motor output. None of them change the input. None of them address nutrient deficiency. None of them address blood sugar issues. None of them address toxicity problems. They just don't do that. So we have to get at why the brain's breaking down to ever have any opportunity to make the brain work better. If you decide to come in for an evaluation, I look forward to meeting you. I will do my best to determine whether or not I think that I can help you. If I can help you, I will lay out an exact plan of what I think proper testing would be, blood testing, specialty testing, and then also go over what would be exactly need to be done. And if I don't think that can help you, I would tell you that as well. Once again, have a good day. God bless. I hope you found this informative. Thank you.